On May 23rd, only 2 new cases of coronavirus infection were confirmed in Tokyo.
先生、だいぶ静かになりましたね。
めっちゃ静かになりましたね。ここは変わらないですけどね、解除されなくて。
The number of novel coronavirus patients at the Tokyo Medical and Dental University Medical Hospital has decreased. The institution has accepted about 350 COVID-19 patients so far. 36 coronavirus patients were hospitalized around April 26th. Currently, there are 18. Japan is now out of a state of emergency. But Yamanouchi says the sense of tension in the medical workplace will remain unchanged. Many people are carried into this emergency room every day. Staff cannot immediately tell whether they're infected with the coronavirus.
近隣の医療機関等を含めて疑いの患者さんやあと陽性の患者さんで重症な場合当院では、受け入れるようにしておりますので。
Last week, the hospital adopted a new way to detect coronavirus infections more quickly.
これがその抗原検査になります。
Japan's health ministry approved a test kit on May 13th. It detects proteins unique to the virus in nasal mucus samples. The accuracy is lower than that of the conventional PCR test, but results come out in about 15 to 30 minutes.
救急患者さんの場合、意識障害であったり、場合によっては本当重篤で心肺停止の患者さんとか、病歴が全然取れないような患者さんとかも運ばれてくることあるので、30分ぐらいで出る検査ができるっていうのは一つ大きなメリットかなとは思います。
More changes are underway in this hospital as they brace for a second wave of infections. They are renovating the emergency floor to make it for coronavirus patients. Water quality testing is just one of the preparation steps. A new facility was set up specifically for outpatients suspected of having the coronavirus. The sign on this building reads Dental Building. There is a dental chair in the room, but it is now being used mainly for coronavirus diagnosis. The building was already equipped with negative pressure rooms and CT scanner rooms. They've come in handy to deal with COVID-19 patients. But the shift has dealt a significant financial blow to the hospital.
歯科診療に関してはかなりのダメージ、8割、9割減というのが現状です。
Accepting coronavirus patients means not being able to accommodate other patients. Okawa says his hospital recorded a 1.2 billion yen fall in revenue in April. The hospital also expects to spend hundreds of millions of yen. It will be used to install air conditioning and negative pressure systems to combat the contagion. Although the government lifted the state of emergency, that does not mean the epidemic has ended.
十分注意しながら防護服を着てケアをしているわけですけれども、やはり毎日緊張の連続ですので、第2波が来たらその病院の職員はですね、かなり今現在疲労が溜まっておりますので、またかなり精神的にダメージが強くなると思います。
The anticipated second wave could hamper not only hospital management, but also be detrimental to healthcare workers. A sustainable strategy will be necessary in what is expected to be a drawn-out fight against the pandemic. Rikako Maruyama, Nippon TV.
We are going to switch gears in a big way. We want to get some international perspective on COVID-19. This week, Japanese Prime Minister Shinzo Abe declared victory over COVID-19 in his country and declared the 7-week state of emergency now over. In total, the country has seen 858 deaths and just over 16,000 cases. So how did a country with 3 times the population of Canada's experience just a fifth of the cases that this country did? Kawamure Yasuhisa is the Japanese ambassador to Canada. I spoke to him a bit earlier about how his country is preparing for a possible second wave.
Well, right. You point a good point. on the day of the lifting the state of emergency to the whole nation, Prime Minister important so that we need to be prepared for the possible second and third wave of infectious attack. We'll continue to follow the 3 non-C policy to avoid the congestions and conference and contacts people. Those are basic principle of code of conduct at the new normal. And also we expand the capacity of the tests, and we'll keep a right track of the infectious clusters. So we need to change our code of conduct in our daily lives, but at the same time, the government on its part will prepare the best availability of the equipments and medical systems, and also test capacity and so on. So combined with the people's response and government's leadership and the infusion of the supplementary budget to support economic activities and social lives, we will see that the trend of controlling the virus will continue.
I wanted to touch on testing capacity, which you mentioned, because in some of what I've read, there has been some concern from some experts in Japan about the level of testing that has been done so far. So how certain can we be that the spread of the virus is exactly how the government says it is, if only, for example, 10,000 tests were conducted between February and April? How much does the government plan to expand testing capacity?
Okay, we will take multiple applications to the situation we have. Currently, we have the case of 16,759. And the peak time, we had daily 714 new cases. Now we have less than 50 or 30 in the last week. And the rate of infections has come down to the level, we call it 0.5 per 100,000 population. This level will enable us to follow intensively the cluster of infection. So we used to do this in a similar way of the cluster intensive measures, PCR tests for necessary people. So we'll continue to do this. But at the same time, we will introduce a new method of tracing infectious spots. It's a new type of technology, which will require no personal information or no worry about the privacy. So it's a new application. So we're planning to introduce such a new system in mid-June next month. And the capacity of tests, in combination of the existing PCR tests, we will also introduce the antigen tests. Antigen tests will come out of the result so quickly. So in combination with the PCR test, antigen test will also play a role. So capacity of the testing people, we will ask the local governments and the universities and so on to have more people to conduct the tests of the PCRs. So all those things will be applied, and we'll see have a right track of the infectious spots.
Okay, Ambassador, before I let you go, I do want to ask you about one other subject. Your country has a lot of experience dealing with diplomatic issues, diplomatic strains with China, and I know you're well aware of what this country is facing right now with its relationship with China, and especially amplified yesterday with the court decision on Meng Wanzhou. I'm wondering if you have one piece of advice for the government in this country to handle a tense relationship with China. What would that advice be?
Okay, in general sense that Japan and Canada are on the same boat. We have China as the biggest, one of the biggest trading partners. But at the same time, we face a very severe challenge in terms of security and political area. So we need to work closely so that China will play a kind of responsive role in international affairs, so that the world, global area would enjoy the prosperity and economic freedom. In the Indo-Pacific Ocean is the area where our two countries, Canada and Japan, face. And this is the source of future development, the prosperity. So we need to preserve the fundamental values such as democracy and free trade and transparency and the rule of law. Those fundamental values are so important for the continuous prosperity of the region as a whole. So we need to work together. So we need Canada's involvement and cooperation in this global efforts endeavor. We have thoughts of so-called free and open Indo-Pacific Ocean, which our two governments talk so frequently these days. So in cope with the new challenge, I think that we need to keep a right balance. We may need to be very tenacious and long-term viewpoint, and we need to be flexible and innovative in terms of communication with China. China has a long history and long tradition, so sometimes we may need speak softly and very calmly, and but at the same time we need to be very consistent and resolutely when it coming to the fundamental values and fundamental principles. So we keep a very cooperative interactions with Canada. We look forward to working closely with you.
Okay, I'll leave it there. Thank you very much, Ambassador. Pleasure to have you with us.
Thank you, Vassie.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.